Okay, so thank everyone for joining me. I appreciate that. And what I'm going to do at this time is provide information on how to be a successful counselor. Now, the first thing I want to do is provide you with some information about my credentials and give you a little bit about myself. First, my name is Ronald Johnson. I was born in this city called Trenton, New Jersey, and I'm currently residing in Connecticut, and I work in New York, the Bronx, as a substance abuse counselor. I have been doing that counseling since 2003, and this is my passion, and this is my chosen career, and this is what I love to do. So the first thing I want to share with you, if you can see this, is my certificate for credentialing in alcohol substance abuse. Okay? My second certificate is my certificate for peer ethics for recovery coach. And I want to share with you, ethics is always a good thing a good tool to possess when doing counseling. Okay? My next certificate is one of the most important ones to me, because this is motivational interviewing. Motivational interviewing is another very good certificate to have, and I will share with you one more, and this is my credentials for ministry. So I guess I kind of left that out. Yes, I am also a pastor. So I did print out a preview. I printed out a presentation. So I'm going to go over the presentation very briefly about some of the tools and resources that I have done for this assignment. Now, my first one is the first page, which states tools for successful counseling. Is there such a thing as successful counseling tools? Yes, there is. As you can see, I have my little pictures there. Hopefully you can see them. You know, I got that from Clip Art. And they have some very nice pictures there. Okay, so one of the things that I want to share is part of my belief for the tools needed for successful counseling. Some of the tools, one of the main tools that are needed is true care and concern. I believe one must have a heart to provide true care and concern for the patients or the clients. Because without that true care and concern, your aura, the way you present the things to them, it will show. And from my experience, most of the patients, they know if you truly care for the work that you're doing or the services that you're providing for them. So it kind of comes out on where your heart is at. Because if your heart is not into it, I can almost guarantee you 9 times out of 10, it will be shown and it will be noticed. Not only by your patients, but by your coworkers, by your directors, your supervisors. They will know if you truly care about the work you're doing, because one of the things happens is it will come out in your performance. It will definitely come out in your performance on if you do have a true care and concern for that career, for the counseling career. Okay? So one of my sources, which is ACA, which is American Counseling Associations, is one of the governing bodies that provide information on how we should conduct ourselves ethically, our boundaries between us and the patients, and also gives us a lot of protection information. Protection for the client's welfare as well as your own as a counselor. So APA is one of the resources that I truly go to when it comes down to gathering information on how I should conduct myself, how I should engage with the patients. That APA is also governs most of the drug programs, facilities, ACA and APA, which is American Psychology Association. Every psychologist and every counselor in the United States is governed by these two entities. That's why I definitely know that it's a reliable source, because we are governed by that. Okay. If any of those rules or laws shall be broken, one can lose their credentials or their licenses. Part of the ACA states avoiding harm to the patient. So it states avoiding harm and imposing values. Avoiding harm, counselors act to avoid harming the clients, trainees, and research participants, minimize to remedy unavoidable or unanticipated harm. So that means that we're supposed to not do harm to the patients. All of these are tools. Again, all of these are tools that will assist you with being successful as a counselor. Then we have integrating motivational interview. Now this is one I got from my school library, which is peer-reviewed, and this is about self-efficiency. And what this one states is self-efficiency is an important mediator or performance and involves the degree to which people are capable, diligent in their work. And this means that counselors should be efficient in the work that they're hired to do. They should be able to possess that true care and concern. They should be able to perform case management, treatment plans, biopsychosocials, assessments. Counselors, that is part of their job. And we, as counselors, should be able to perform those duties diligently and effectively and professionally. Okay? So then we have my other source, which involves critical thinking, an effective tool. And they have a new counseling thing that they want to add into this counseling, which is called physiological counseling, which involves critical thinking. So these individuals want to promote critical thinking. Is a big part and will be a major part of counseling, which have just been put in effect and will be in effect very soon in a lot of the programs and the job chosen careers that we have. So that was also peer reviewed from my school library. Now, because I only have 5 minutes, I'm gonna go down to my conclusion about tools to have for successful counseling. So in my conclusion, it says successful counseling tools have a true care and concern. That was the first one I mentioned. Provide ethical and professional services. Make all the sessions be about the patient. And always seek training and supervision. If you do those things, there is a high possibility. If I had to give a percentage, it would be, 90% out of 100, you will be a successful counselor. And you will have successful sessions with your patients. Again, always remember, empower the patient. Make sure your sessions is about the patient. And make sure that you keep that true care and concern to help individuals that are either addicted or just seeking counseling help to assist them and guide them in the right direction. Last but not least is my references, which I will bring the page up so that you can see them. These are my references here. And I thank you for your time. And with that, I'm going to end the session or end this assignment. And I really enjoyed it. And I really hope that I provided you with some information that if you're going into the counseling field with some of the tools that are needed for you to be successful. Thank you.